Hello everyone, I am urologist Omar Makaya. Today I will talk about chronic prostatitis and prostate massage. I have frequently used it in the treatment of chronic prostatitis. I think patients also benefit greatly from it, although not every patient does. Some patients can feel very relieved even after the first session of massage. They say that the fullness in the prostate area disappears and a void is created. This is truly heartwarming. It satisfies us greatly. I am truly delighted in such a situation. We can provide immediate relief to this patient in a very short time. In some patients, symptoms may worsen initially when massage is performed for chronic prostatitis. As the sessions progress, after the second, third, or fourth session, the patient's complaints may subside in chronic prostatitis. I mentioned this in previous videos as well. In chronic prostatitis, it is possible to empty the sacs and glands inside the prostate and remove the mucus-filled small crystallizations through prostate massage. At the same time, adding treatments such as shock wave therapy or magnetic chair therapy, or ozone therapy, can increase the likelihood of the patient benefiting. If we think about it logically, what is the issue, friends? Just as kidney stones cause kidney pain when they block the kidney's passageway, similarly, when the prostate's ducts become blocked, even if there is no infection, it can cause discomfort. My knowledge, experience, and expertise in treating prostatitis began to influence me more during the early stages of my specialization. You might ask, how come? You were at residency for 6 years, didn't you see any cases of prostatitis? Friends, we rarely see prostatitis during the residency. Even if we do see it, we can't pay much attention to it. Why? Because our assistant training program focuses primarily on scheduling prostate surgery, kidney stone surgery, and cancer surgery. We immediately intervene for those patients in a fast-paced environment. Because patients coming to the university hospital are already in critical condition. For example, the prostate is blocked, and surgery is needed urgently. If a kidney stone is blocked and surgery isn't performed, the patient will lose their kidney. Cancer patients are already the most urgent patient group. So, among all these patients, I couldn't pay much attention to prostatitis patients. Their complaints didn't seem very meaningful to me. However, the patient actually has serious complaints. Unfortunately, these patient groups don't receive adequate attention in the outpatient clinic compared to other patients. This is because other patients have quite a lot of serious complaints. So, when we compare the complaints of a patient who will lose their kidney with those of a prostatitis patient, we need to intervene urgently for the kidney patient. Not performing urgent intervention for a prostatitis patient does not cause any problems for the disease, but it has a very negative effect on the patient's quality of life. It can lead to serious depression and erectile dysfunction. Unfortunately, we couldn't do a detailed evaluation during our residency. But after residency, I started to have the opportunity to meet with these patients one-on-one, evaluate them, and assess their response to the treatment I gave them. This is a very important opportunity. Why, you may ask? Because as residents, we spend 1 or 2 years in the outpatient clinic. You work in the same outpatient clinic for a year, providing treatment, but you don't know what happens to the patient after a year. You never see them again. During the 6-year residency period, you only have the opportunity to stay in the outpatient clinic for 1 year. The outpatient clinic is also the most comfortable department, as you also work in the ward. You also work in another department called endoscopy or in the operating room. The outpatient clinic is the most comfortable part of our residency, as you only interact with the patient one-on-one. It's not a physically demanding department. But of course, 1 year is not a very long time, and there are other seriously ill patients who come to the outpatient clinic. Chronic prostatitis patients get lost in the crowd. So what did we start doing here? We started doing prostate massages. For example, prostate massage can actually have an effect on some patients even in the first session. I wanted to film a video today because of such an incident. The patient said, "Doctor, I feel a sense of relief. I'm experiencing the sense of relief that I've been wanting and waiting for a long time." Why? Because with prostate massage, we have the opportunity to drain those millimeter-sized sacs inside the patient's congested and swollen prostate. With prostate massage, we relieve the blocked prostate ducts from the patient's rectum to the prostate. When those ducts drain, the patient feels relief, like pus draining from an abscess. Is it like this for every patient? Of course not. But some patients respond so quickly to prostate massage. You really can't believe it. Patient satisfaction is evident at that moment. In the first few massages, the patient feels uncomfortable with the massage. Then, after 3, 4, or 5 massages, the patient can experience significant relief. In other words, prostate massage is one of the treatments I use most often and have had the best results with in the treatment of prostatitis. What else do? We add shock wave therapy to the patient's treatment. We can add many treatment protocols such as antibiotic treatment, herbal treatments, tadalafil treatment if necessary, magnetic chair or ozone therapy, depending on the patient's condition. If the patient has excessive complaints about erection or frequent urination, we add these accordingly. For example, a patient who came today has had testicular pain for about 5 years. The patient also has erectile dysfunction. Additionally, the patient has previously been diagnosed with Gardnerella vaginalis infection related to prostatitis. He has used Flagyl. He has benefited from Flagyl. This patient has impaired erectile function. His testosterone level is low. The patient has frequent urination. For example, this patient urinates 10 times every night. It would be wrong to send this patient away with only chronic prostatitis and these treatments, of course. It is necessary to start medication treatment that will reduce nighttime urination, strengthen urinary functions, and correct erectile dysfunction. I think we will get a good response from this patient as well. However, the main topic of this video is whether I am satisfied with the results of prostate massage in chronic prostatitis. I am truly amazed by the results. Patients sometimes experience significant improvement. Some patients report feeling relief as early as the first session. Of course, this is not applicable to every patient. This video generally covers chronic prostatitis and prostate massage. Thank you for listening, and best regards.